Hello, my name is Celia Correa, and my PowerPoint presentation is about effective risk communication. Some of the objectives that I would like to discuss in this presentation include what is the risk communication and why is it important? Second, what is the communication process? And third, risk communication among the elderly population, among children, and among individuals with disabilities. So, what is risk communication? According to the World Health Organization, risk communication refers to the exchange of real time information, advice, and opinions between experts and people facing threats to their health, economic, and social well being. Risk can be defined as the likelihood that an occurrence will happen against certain consequences. Risk communication is a two-way system in which both the sender and receiver engage in communication and provide feedback to each other in order to improve understanding. Risk communication is also multidimensional, meaning that information gets shared via different mediums and modes. So, some challenges to effective risk communication include using confusing terminology, such as slang, jargon, or even certain dialects can be difficult for some people to understand. It can also include differences in backgrounds and experiences. So, some individuals who may be more familiar with certain information may have a slight advantage than others in understanding information and material and maybe more able to make decisions faster. It can also cause misinterpretations. So, it's really important to understand how communication or information is being communicated in order for people to understand truly what is trying to be intended and also to avoid sending mixed messages. It can also include environmental noise. So, if there's a lot of distractions, maybe a lot of um, entertainment or other factors going on in our surrounding, it can make it hard to engage and focus in information. It can also include mixed messages. So, um, information can be interpreted in many different ways by individuals, and because we all have different information and backgrounds, it can predispose us to sometimes interpreting information in ways that we want to hear, not necessarily how it's intended. It can also include age differences, so it's really important to consider the age of the audience and to make sure that information is being allocated to them effectively in a way that they will understand. So, why is effective risk communication important? So, first and foremost, communication is important because it helps us to share information that is essential for individuals to have and to know. It can also help people make informed decisions and to be able to really feel confident in the decisions they're making. It can also share the right information to proper individuals and groups. So it's really important that as much of the health information can be communicated and delivered to all individuals because it can truly make a difference having all the information necessary to evaluate what options are good for individuals when it comes to making health choices. It can also help lead to take action. It can reduce disease threats or risks. It can help avoid miscommunication, and it can improve quality of life. So, one uh, factor that I would like to discuss is the risk communication process. And in this process, one of the first steps is to identify the hazard. It's really important to be able to identify what the problem or hazard is in order to truly be able to address it. The second step includes being able to assess the hazard or risk. And it's really important to make sure that the problem is being identified in order to reduce it or eliminate it and be able to develop effective interventions. The next step includes developing policy. So it's really important to analyze what avenues and resources can be utilized and developed to assist with the problem, to be able to diminish it, or to be able to create other alternatives. The fourth step includes implementing the policy. So in this step, it would be uh, the way that we would know if an intervention is working or whether it's not being effective. It's important to consider how it will be established and what population it will be serving. And the fifth step includes being able to evaluate the policy. So it's really important to develop an assessment that can truly find and determine if it's being effective in reducing or eliminating that hazard, if the intervention should continue or if it needs to be changed or terminated at all. So one of the first populations that I would like to discuss includes the elderly population. And the elderly population is faced with making important health and wellness decisions as well as with end of life directives. So the elderly population is faced with making really critical and really sensitive decisions regarding their health, and they may not be easy, and some of them may even include death related. Effective risk communication is important among elderly populations in order to help them make informed decisions, take action, make life changes, comply with treatment and medications, reduce morbidity and mortality, and improve quality of life. The elderly may be faced with increasing analytic inefficiencies and may rely more on emotional or affective decision making. Given that emotional and affective may be used as a source of information in judgment and decision making, communicators need to be cognizant of the effective content of the messages they are imparting. When developing a message, risk communicators should ask, are there age-related differences in responses to the effective information contained in or evoked by the message? Is the effective information helpful or unhelpful in creating accurate risk perceptions? Does the effective information motivate older adults to adopt appropriate protective actions? So, as older adults lose cognitive abilities to make informed decisions, they may rely more on emotions to make choices. It is easier to remember how we feel about certain information than to remember every detail of what information is communicated. And with elderlies, population, they can sometimes be a very stubborn population, and so it's really important to develop an awareness of what information may be sensitive, and if something is hard for them to participate or to act on, then it's important to understand how we can communicate it better or reduce some of that pressure. So some useful tips when communicating with the elderly includes being able to give the elderly extra time to answer, process, and ask questions. It also includes giving them undivided attention and eliminating distractions. It includes providing face-to-face interactions and adjusting communication to individual needs. It includes engaging in active listening, using simple language that's direct and clear, and also treating each patient with respect and dignity. So, a second group that I would like to address includes children, and children can be a very vulnerable population that need guidance and support to navigate health risks and make good choices. Some common issues include chemical and toxicity safety, drug and alcohol use, smoking and tobacco, body safety, stranger danger, fire hazards, risky sexual behavior, and communicable disease. Some helpful strategies when communicating with children includes being able to engage parents, friends, teachers, and community members to take responsibility and educate children about some of the risks and hazards that they can face. It includes considering age as a factor that needs to be accounted for when discussing risks to children due to certain risks being more common at certain ages than others. Communicators need to genuinely care about the well-being of children. If not, they will not listen or participate. And children are very good at identifying who cares about them and who doesn't. Children are more likely to listen to someone they trust. Risk needs to be communicated at a level children can understand and with language that they are familiar with. If they cannot engage or understand what is being said, then the communication process has failed. And I found a video about a little girl named Sir, who lives in a village and is witnessing the spread of a disease in her community. And she's seeing her community get sick, but she's also able to witness how that same community and healthcare providers are able to engage in risk communication in order to avoid the disease spreading, and also to establish healthcare policies that can keep the community healthier and safer. And she's also able to witness how different countries are able to form a global unit and share information among each other to keep diseases reduced or eliminate them, and to be also to create a more healthier global community where everyone can share and work with each other as a family. So I would like to discuss teenagers briefly here, simply because they are a very sensitive population, and they're at a very critical stage in their life. So teens are one of the toughest groups to communicate with. Teens find themselves at a point where boundaries are tested and they're trying to find their own independence. Peer pressure is strong and very influential. Teens may not want to disclose certain health behaviors to others due to fear of judgment and punishment. And sometimes healthcare providers can play a critical role in being some of the few people who can guide them to evaluate their health choices. And so it's really important to be effective, and clinicians need to be equipped with the communication skills necessary to engage youth in a health promoting process that emphasizes openness, trust, and respect for confidentiality. So the third group that I would like to discuss is the disabled population. And populations with disabilities include those with physical and intellectual disabilities. Disabled populations face discrimination, abuse, and prejudice. Individuals with disabilities, caretakers, and healthcare staff need to be educated and trained on how to practice effective risk communication in order to avoid accidents, make informed decisions, and improve quality of life. Some strategies that are helpful in communicating risk include sitting eye to eye with individuals in a wheelchair. It's also helpful to introduce oneself when speaking to individuals with low vision or blindness. It also helps to be able to ask individuals who are deaf or hard of hearing how they would like to be communicated. It also helps to talk to individuals with speech impairments as normally as possible, with no shouting, oversimplifying, and using normal tone of voice. And also, it helps to treat individuals with cognitive disabilities with respect and dignity. Communication needs to be changed or modified in order to deliver information effectively. So in conclusion, effective risk communication is not easy, but it is very important and achievable. Risk communication needs to be formulated and modified to its intended audience. Children, the elderly, and individuals with disabilities are some of the most vulnerable populations in the world. Health promotion and risk communication are achievable through various modes and mediums. All individuals should be treated and spoken with respect and dignity. Effective risk communication involves the cooperation of the individual, the caregivers, and healthcare professionals. So it is everyone's responsibility to help each other achieve health, to reduce disease, and eliminate negative health outcomes as much as possible. Thank you.